Right now, as you watch this, billions of people around the world are living with a condition that affects the most visible part of their body, something they cannot hide, something that touches their confidence, their careers, their relationships, and in some cases, their survival. We're talking about the skin, the largest organ in the human body, your first line of defense against the outside world, and yet it is under attack, silently, constantly, on a global scale that most people never fully appreciate. According to data presented at the 77th World Health Assembly, there are over 3,000 distinct skin diseases recognized by modern medicine, conditions that impact more than 3 billion people globally, across every age group, every continent, and every economic background. 3 billion people. That's nearly 4 out of every 10 humans alive today. This is not a niche medical issue, this is a global health crisis hiding in plain sight. So what exactly are skin diseases? At their most fundamental level, skin diseases, also called dermatological conditions, are disorders that affect the skin, nails, hair, and mucous membranes. They range from conditions you might barely notice, like mild acne, to life-threatening diseases like melanoma. The skin itself is the body's largest organ. It helps regulate internal temperature and prevents dehydration. It keeps harmful microbes out. When this organ breaks down, whether from genetics or the environment, the consequences ripple. The most well-known include atopic dermatitis, commonly called eczema, and psoriasis, which produces scaly skin, rosacea, which causes flushed skin, vitiligo, which creates patches that lose pigment, and skin cancer. But the list goes far deeper than that. Here is what the data tells us about where we stand right now. In 2021 alone, approximately 4.69 billion new cases of skin disease were diagnosed worldwide. These conditions now rank as the 4th leading cause of non-fatal disease burden globally. Let that number sink in. Nearly 5 billion cases in a single year, more than a third of the global population. And the problem is not distributed equally. High-income regions, particularly North America, report significantly higher rates of diagnosed cases, not necessarily because the diseases are more common there, but because access to healthcare and diagnostic services is far greater. In contrast, regions like Central Sub-Saharan Africa record lower rates, reflecting gaps in medical infrastructure. Meanwhile, in Europe alone, more than 94 million people report uncomfortable skin sensations like itch, burning, or persistent dryness. In a population study spanning 27 European countries, the most prevalent conditions were fungal skin infections, followed by eczema and acne. To truly understand skin diseases, you have to understand the categories they fall into. First, inflammatory and immune-mediated conditions. These are diseases where the body's own immune system misfires. Psoriasis is a prime example, an autoimmune disorder where the growth cycle of skin cells accelerates. Second, infectious skin diseases. These include bacterial, viral, and fungal conditions. Viral warts and molluscum contagiosum are among the top 50 most prevalent diseases globally. Third, skin cancer. This is where the stakes become highest. Skin cancer is the most common cancer diagnosis in the United States. Though melanoma makes up less than 5% of cases, it accounts for most skin cancer-related deaths. Fourth, genetic and rare skin diseases. Conditions like epidermolysis bullosa cause skin so fragile it blisters easily. Why are skin diseases becoming more prevalent, not less? Several forces are converging. Climate change is playing a direct role. Rising temperatures and extreme UV radiation are known triggers. Eczema flares worsen with heat and pollution. Skin cancer risks escalate with prolonged UV exposure. Fungal infections thrive in warmer, wetter environments. Stress is another underestimated driver. Conditions like acne and rosacea are known to worsen under psychological stress. In an era of growing global anxiety, skin conditions are bearing the consequences. There is also a deep inequality in access to care. Wait times for a specialist can extend up to 12 months. The economic burden is staggering. In the US alone, the yearly cost for psoriasis is estimated up to $63 billion. This matters beyond statistics. Skin disease carries a psychological weight that is rarely discussed. Visible skin conditions can affect self-esteem from childhood. They influence social interactions and careers. Studies consistently show elevated rates of anxiety and depression among those living with chronic skin conditions. 40% of non-working patients attributed their inability to work directly to their condition. This is not vanity, this is quality of life. This is human dignity, and the global response has been insufficient. Universal health coverage cannot be universal without addressing skin health. The skin is where the human body meets the world. It tells the story of where we've been. It tells how our body is fighting to protect us. Skin diseases are not cosmetic footnotes. The science is advancing. New biologic drugs are giving relief to psoriasis patients who had no options a decade ago. AI-powered diagnostic tools are beginning to reach underserved communities. But the pace of progress must match the scale of the crisis. The world owes them action. If this video helped you understand skin diseases better, like, share, and subscribe. Knowledge is the first step.